All right, so now I'm going to assist the patient with feeding. So the first thing I will do before I enter the room is to check the patient's chart, look at the orders, look at the specific diet that's ordered for them. For this particular patient, it'll be a normal diet. I also will check to see if there's any notations of the patient having any difficulty swallowing. Of course, I will ask the patient that myself as well, and I will perform hygiene before entering the room. So, hi, Miss Jackson. Paige, my name is Akila. I will be your student nurse today. I am here to assist you with feeding. Is that okay?
Yes.
Are you hungry at the moment?
Yes.
Okay, so the doctor has placed you on a normal diet, meaning you can have anything, no restrictions. So, is there anything in particular that you do not eat? You do not like?
I do not like cheese by itself.
Okay. Do you have any allergies to any foods in particular?
No.
Okay. So, can you please, first of all, state your name and your birthday?
My name is Paige, and my birthday is March 1st,
Of what year?
1943.
Okay, great. All right. So, what I am going to do first is get your tray ready. Okay? So, all right, I would come in with a meal tray. I would place it on her bedside tray. First thing I would like to do is I would like to wash my hands again in front of the patient so they know my hands are clean. I will also give the patient something, a nice hygiene towelette to clean their hands with. I will also assist if the patient needs help. You need help with me to get your hands cleaned up?
Yes.
Okay. I have a little towelette for you right here. Let's go ahead and wipe your hands, get them nice and clean. Also, if the patient has is in a hospital bed, I will make sure to raise the bed up to where it's comfortable for me to avoid back injuries. I also will provide a towel to cover you up, okay?
Okay.
This is just a nice little towel to cover your clothes. It prevents you from getting soiled. I will not call it a bib. Out of respect for the patient, you know, want them to feel degraded in any type of way. So the next thing I will do is grab a chair that is comfortable and sit at the side of the patient, at the bed with the patient, eye level, and in a comfortable position. All right, so the first thing I am going to do is I'm going to explain what we have for you to eat today.
Okay.
So we do have, it looks like some ribs, some corn, mashed potatoes. We have some dessert, piece of cake for dessert, and we have some fruit, an apple. Okay? So I am going to just give you bite-sized portions of the food. You take your time, you chew all your food, and you swallow it, okay?
Okay.
All right. So I'm going to just go around your plate and just give you a little bit of each item. Is that all right with you?
Yes.
All right. So I will start with the mashed potatoes. You can go ahead and take a bite. All right. And the food is not too hot. Of course, I would make sure the food is not too hot prior to giving it to the patient. So, would you like something to drink? I do have some water and some juice available.
I would like some water.
Okay. Here you go. Go ahead and sip from the straw. All right. And I will continue feeding the patient bite-sized portions of food. I will not rush the patient, and I will also offer beverages to drink in between each bite. Once the patient is done with their meal, I will go ahead and remove the tray to the side, dispose of any uneaten food, which my patient has eaten 100% of their food today. I will also remove the towel from the patient. I will offer hand hygiene again for the patient. I will assess and make sure the patient tolerated the food well. I will also document that. So patient had no problem swallowing. Patient did not ambulate or aspirate. Patient did not choke. And because I did make sure to have her at a proper position prior to feeding her as well to avoid aspiration. So I will also make sure once I'm finished disposing of the patient's food, I will perform hand hygiene and I will document my findings of normal normal swallowing. Patient, I will document my I's and O's, how much the patient had, how much they drink, how much they ate. So the food will be based off percentage. The liquid will be based off of mLs. So I think that's it. So were you satisfied? Did you have enough to eat?
Yes.
All right. Thank you. Well, I'm going to give you your bedside table. Here's your call light. Make sure you give me a call if you need anything else. Okay?
Okay.
All right. Thank you. And I will perform hand hygiene when I leave the room.